Hello everyone, I'm a physician with over 30 years of experience in medical research and patient care. Today, we're diving into a topic that's critical for your health, but often overlooked: bone densitometry, or DEXA scanning. If you're wondering how to keep your bones strong, prevent fractures, or understand osteoporosis, you're in the right place. This video is like sitting down with me for a personal consultation. We'll explore what bone densitometry is, why it matters, and how it can change your life. Plus, I'll share real patient stories and my expert tips to help you take charge of your bone health. By the end, you'll feel empowered to protect your skeleton for years to come. So grab a cup of tea, get comfortable, and let's get started. Don't forget to like, subscribe, and hit that notification bell so you never miss a health tip from me. Why bone health matters. Your bones are the framework of your body. They support you, protect your organs, and allow you to move. But as we age, our bones can lose density, becoming brittle and prone to fractures. I've seen patients in their 50s or 60s who thought they were healthy until a simple fall led to a hip fracture. That's when they realized their bones weren't as strong as they thought. Bone densitometry is a game changer because it lets us peek inside your bones to measure their strength before a fracture happens. Let me share a story. A few years ago, I met Sarah, a 62-year-old retired teacher. Sarah was active. She loved gardening and yoga, but she started noticing back pain. She brushed it off as just aging. During a routine checkup, I recommended a DEXA scan because she was postmenopausal and had a family history of osteoporosis. The results showed osteopenia, a warning sign of low bone density. That scan was a wake-up call. We worked together on a plan: calcium-rich foods, weight-bearing exercises, and a medication to slow bone loss. Today, Sarah's stronger than ever, and she's back to her yoga classes without pain. Her story shows why bone densitometry isn't just a test. It's a tool to reclaim your health. In my opinion, bone health is as crucial as heart or brain health, yet it's often ignored until something goes wrong. The science is clear. After age 30, bone density naturally declines, especially in women after menopause, due to lower estrogen levels. Men aren't immune either. By age 70, they're at risk too. Factors like smoking, excessive alcohol, or long-term steroid use can accelerate bone loss. That's why I urge everyone over 50 to talk to their doctor about bone health. A DEXA scan can catch problems early, giving you a head start on prevention. What is bone densitometry? Bone densitometry, or DEXA, stands for dual energy X-ray absorptiometry. It's a fancy name for a simple test that uses low-dose X-rays to measure bone mineral density, or BMD. Think of it as a snapshot of your bone strength. The test focuses on key areas like your spine, hips, or forearm, places where fractures are most likely to occur. Here's how it works, based on my experience and the Johns Hopkins research. You lie on a padded table, fully clothed, while a scanner arm moves over you. It's painless, takes about 10 to 30 minutes, and the radiation is minimal, less than a day's worth of natural background radiation. You don't need to fast or do anything special beforehand, but avoid calcium supplements for 24 hours and let the technician know if you've had recent imaging tests with contrast dye. Pregnant women should skip the test due to the small radiation risk. The results come as T-scores and Z-scores. A T-score compares your bone density to a healthy young adult. A score of -1.0 or higher is normal. -1.0 to -2.5 means osteopenia, and -2.5 or lower indicates osteoporosis. The Z-score compares you to people your age, which helps spot unusual bone loss. These scores guide your doctor in recommending treatments, from lifestyle changes to medications. In my practice, I've found DEXA scans invaluable for catching issues early, but they're not perfect. They measure density, not bone quality or fracture risk directly. Things like your balance, muscle strength, or fall risk matter too. That's why I always pair DEXA results with a full health assessment. My advice? Don't just rely on the scan. Use it as part of a bigger plan to stay active and strong. Who needs a DEXA scan? Not everyone needs a DEXA scan, but certain groups are at higher risk for bone loss. Based on Johns Hopkins research and my own expertise, here's who should consider it. Postmenopausal women, especially those over 65, as estrogen decline weakens bones. Men over 50, particularly if they have risk factors like low testosterone or a family history of osteoporosis. Anyone with a fracture after age 50, as it could signal weak bones. People with risk factors, such as smoking, low body weight, heavy drinking, or long-term use of steroids or other medications that affect bones. Patients with conditions like rheumatoid arthritis, hyperthyroidism, or malabsorption issues that impact bone health. Let me tell you about John, a 68-year-old patient of mine. John was a smoker for 30 years and had been on steroids for asthma. He came to me after a wrist fracture from a minor fall. His DEXA scan revealed osteoporosis. John was shocked. He thought osteoporosis was a women's disease. We started him on weight-bearing exercises, a bone-building medication, and smoking cessation support. 2 years later, his bone density improved, and he's hiking with his grandkids. John's case taught me that men need to prioritize bone health too, and DEXA scans can be a lifesaver. My take? If you're over 50 or have risk factors, don't wait for a fracture to get tested. Talk to your doctor about a DEXA scan. It's often covered by insurance for at-risk groups, and the peace of mind is worth it. I also recommend tracking your risk factors, things like diet, exercise, and family history. Knowledge is power when it comes to your bones. One thing I love about DEXA scans is how easy they are for patients. You don't need to stress about preparation. Just wear comfortable clothes without metal, leave the belt and jewelry at home, and tell the technician about any recent imaging tests or if you're pregnant. The scan itself feels like a breeze. You just lie still while the machine does its work. I remember Maria, a 55-year-old nurse who was nervous about her first DEXA scan. She thought it would be like an MRI, with loud noises in a tight space. I reassured her it's nothing like that. When she had the scan, she laughed afterward, saying, "That was easier than getting my blood drawn." Maria's results showed early osteopenia, so we focused on strength training and vitamin D supplements. She's now a DEXA advocate, telling all her friends to get tested. My professional opinion is that the simplicity of DEXA scans makes them accessible, but patients need to be proactive. Don't skip follow-up scans if your doctor recommends them. Bone density changes over time. Also, ask questions about your results. Understanding your T-score and Z-score empowers you to make informed decisions. If your doctor suggests medication, discuss the benefits and risks. I've seen patients thrive by combining medical treatment with lifestyle changes, but it starts with that first scan. Let's clear up some myths I hear in my practice. Myth 1: only women need DEXA scans. False. Men lose bone density too, especially after 70. John's story proved that. Myth 2: if I feel fine, my bones are fine. Not true. Osteoporosis is silent until a fracture occurs. Sarah's back pain was her only clue. Myth 3: DEXA scans are dangerous. The radiation is minimal, safer than a chest X-ray. Myth 4: I'm too young to worry about bones. Bone loss starts in your 30s, so building strong bones early is key. My take: don't let myths stop you from getting tested. Knowledge dispels fear, and a DEXA scan is a low-risk way to understand your health. If you're unsure, talk to your doctor or reach out to me in the comments. I'm here to help. Bone health isn't just physical, it's emotional. A diagnosis of osteopenia or osteoporosis can feel overwhelming. I've had patients cry in my office, worried they'll become frail or lose independence. I tell them, A diagnosis is not a sentence, it's a starting point. Take Rachel, a 60-year-old artist diagnosed with osteoporosis. She feared she'd have to give up painting because of back pain. We created a plan with physical therapy, medication, and ergonomic adjustments for her studio. Rachel's now exhibiting her work again, and she says her diagnosis pushed her to prioritize self-care. Her resilience inspires me. My advice: don't let fear define you. Connect with support groups, talk to loved ones, and work with your doctor to create a plan. You're stronger than you think, and your bones can be too. We've covered a lot today, from the science of DEXA scans to real stories of patients like Sarah, John, Maria, and Rachel. Here are the key lessons. Bone health is vital at any age. Don't wait for a fracture to act. DEXA scans are simple and powerful. They catch bone loss early, giving you time to make changes. You're in control. Nutrition, exercise, and lifestyle choices build strong bones. Knowledge is empowerment. Understand your results and work with your doctor to create a plan. Stay positive. A diagnosis is a chance to take charge of your health. I hope this video has inspired you to prioritize your bones. If you're over 50 or have risk factors, talk to your doctor about a DEXA scan. Share this video with someone who needs to hear it, and let me know your thoughts in the comments. Have you had a DEXA scan? What's your favorite way to stay active? Let's keep the conversation going. Thank you for watching, and I'll see you in the next video. If you've made it this far, I know you're someone who truly cares about your health, especially the strength of your bones and joints. Thank you for watching this video. I hope the new tips and insights we've explored together will help you live a healthier, more vibrant life every day. But here's a quick heads up. On platforms like YouTube, you might come across ads from pharmaceutical companies promising miracle products. Remember, lasting bone and joint health doesn't happen overnight. Issues like joint pain or osteoporosis take time and consistency to improve. Instead of chasing quick fixes, trust in the power of a natural lifestyle. Eat wholesome foods, stay committed to exercises that support your body, and keep learning about how your body works. Which tip from this video did you find most helpful? Drop a comment below. I'd love to hear your thoughts. If you enjoyed this content, don't forget to hit like, subscribe, and ring the notification bell so you never miss our upcoming videos. Let's build a healthier future together, starting today. Disclaimer: the information provided in this video is for educational and informational purposes only. The information provided is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or watched on this channel. Reliance on any information provided by this channel is solely at your own risk.